So I was getting into questions about your lessons learned over the last 6 weeks, 8 weeks. I think time is kind of a blur right now. Um, can we just do a round robin of sort of what your lessons learned have been, considering that this pandemic has not probably allowed us to do the level of planning that we would normally do when we have to make big changes? So, Brande, let's start with you.
I think that, I consider this crisis communication. None of us had expected this or planned for it. And so some of the lessons learned are trying to do the pacing, because I mentioned before, we're working many hours, there's a lot of material being produced. And so a lesson learned is just, being able to pace ourselves as we're producing this content. But the one piece that I think is that not to be afraid of experimenting, not being afraid to innovate during this time. It gives great opportunity that maybe before we would have, been a little bit slower to try certain things. And right now we've just been in the thick of it. So we've been making very quick decisions, thinking very fast. One of the things that I think is really great that we did is our chief experience officer said, let's be scrappy. And so he suddenly said, why don't we do videos? Why don't we just use Zoom? Because usually we're, planning those things out and, having things all polished and set. And in this time frame, we just started producing daily videos. I think the idea came up 2 days later, we had videos, we're putting them on the website. And so even with our templates, we hadn't tried various things and we now have so much content. It's like, well, let's just experiment and see what works. And it worked and we were able to get things up. So I think that's a lesson learned, is to not be so afraid sometimes and overthink if something will work or not, and to experiment and move forward. And it works in this crisis communication situation, has kind of forced us into it, and we've had great success.
That's awesome. That is so good to hear. I think healthcare often gets criticized for moving slowly. Not so much anymore. Lisa, I would love to hear your thoughts on that, sort of what your lessons learned have been. And I'm picking on you specifically because you are in what's considered a hotspot for positive testing.
Yeah, we are. We have the most COVID cases in the region, in Chicago, at our hospital, and yeah, it's just, we have to be as nimble as possible. And like Brande said, we are just turning on a dime and making decisions and things that maybe aren't entirely fully thought out. We just have to run toward. And then also, we have to keep an eye on what the state government and the governor's office is doing to inform when we communicate certain things. We had to kind of phase our testing announcements for the public because we had to wait till we were ready to accept folks who were not existing patients. So, there's been a lot of phasing and ramping up, but being ready to move as fast as we can, to serve the community.
Absolutely.
And we've had quite a few viral stories, and being ready to manage those. It's been fascinating and really fun to see the engagement.
Awesome. I will talk a little bit later about what you're seeing work as you guys are launching all these quick experiments. Mm-hmm. Stephanie, so can you talk a little about your lessons learned as you support clients all over the healthcare space?
Sure. I think the key word for us and my organization has been flexibility during this time. One of our core values as an organization is something we call flex your ingenuity. And I really love that as a core value for the work that we do every day. I think that this situation, unprecedented as it is, has really, I don't want to say forced, I want to say it's given us the opportunity to really be flexible in our ability to respond, flexible in the way that we're responding to our clients. Some of our clients, I'm thinking of pharma in particular, if you think about an industry like that that's highly regulated, where there are very tight compliance restrictions, where there's high risk, it's hard for those organizations to pivot quickly. That's just not in their nature, because they're protecting themselves and they're protecting their patients and the physicians that use their products. But even our pharma clients have been tasked with sort of pivoting and being flexible We're looking at helping clients, enroll folks in clinical trials electronically now. We're looking at our pharma clients, considering solutions for, people who are self-monitoring themselves at home, who can't get to the doctor or who are afraid, to go out to the grocery store or afraid to exercise outside. How can we keep those people on track? How can we keep those people managing their health and maintaining their medication adherence and some of those other things? So it's just, this situation has called for flexibility, and I'm just so proud to say my organization has stepped up 10,000 fold.
Wow, that's like exciting and kind of like, I could see how that would make people nervous. Like, we have to do everything electronically. That used to be so regulated,
Yeah.
And so heavily controlled. Thank you for sharing that.
Yeah.
Kimberly, what have been sort of your lessons learned over the last 6 to 8 weeks?
I think some that have already been mentioned, being nimble and pacing yourself and prioritizing. Like, we always have to prioritize incoming requests and the projects, but now it's even more important because we have limited resources, less time, and the pressure is greater because there are bigger things at stake. And so I think that making sure that we're helping all the stakeholders and they're understanding why maybe their projects or their updates might come after more urgent needs, but also trying to protect my team too, so that they're not feeling burnt out, and we're taking time to also enjoy life outside of work and, trying to talk like humans again. I think that's also something important that we need to pause and, just to try to, work together as a team, but also get through this together.